Hello, everyone, and welcome to another episode of the MedEd Well podcast. Today, I am joined by Dr. Sarah Neitzel. Dr. Neitzel is a surgical podiatrist practicing in Western Washington. She has owned her own private practice for the last 8 years, having built out a new office space in 2020. Additionally, she has started a second business with a medical pedicure manicure spa that is located within the same office space as her practice to allow high-risk patients and clients a safe place to have foot care. Last year, Dr. Neitzel started a coaching and consulting business for private practice physicians looking to make their practice and career one that is fulfilling both for the doctor and the patients. Dr. Neitzel, welcome to the show.
Hi, thank you so much. I'm excited to be here.
Thanks. Tell me a little bit about yourself and your journey to medicine.
Well, I went to my medical school and podiatry school in Chicago. Did most of my residency and training, everything there. It was great, but Chicago just really wasn't my home. So I ended up through residency trying to figure out where I wanted to go. And I'm from the West Coast. So, I kind of missed my mountains and my water. And so I was trying to pick between, Washington and Colorado. Those were kind of my two that I was down to. And I couldn't make up my mind. And that happened to be the year that the Broncos and the Seahawks went to the Super Bowl. So I just decided that, okay, well, wherever I move, it's going to be whoever wins the Super Bowl. So yeah, it was a good choice. And I moved out to Washington. I knew I wanted to do private practice right out the gate. So I made sure that I was kind of lined up with other people that did private practice. But that being said, there is a lot of hiccups that go on when you're first getting into that, especially if you're running the business yourself and trying to learn the billing and all the other stuff by yourself. I know better now. Whenever I start any business now, I have a whole team of people because I realize there's no way I should know how to do those things. We did not get taught that in residency. So while I tried to kind of figure all that out, I did spend a little bit of time working for a wound care center at a larger hospital institution. It was just like a kind of a part-time gig. But I did get to see the effects that kind of the hospitals have to, I'm trying to think how to word this. I can see where the hospitals are really trying to move a lot of patients through. And I think the doctors really get, kind of sucked into that. And when you can't spend as much time as you need to, especially with like a wound care patient, there's so many things that go into diabetic foot wounds that if I don't get to spend that time with somebody and we're just like moving me on to the next room, I'm not really getting that like patient doctor relationship, which is why I went to med school, So I really knew at that point, even after having that secure paycheck and that was helpful for a little bit, I knew at that point, I was like, nope, I just need to do private practice. Like I can't function where I don't have that relationship with people. I don't have enough time with everybody. And that's hard. And I think, even though I've always done private practice and it's allowed me some flexibility of hours, I think that not getting to spend enough time with patients was actually a harder thing for me than not being able to spend enough time at home. Because I think that really was a big part of why I went into medicine. So I've done private practice. It's been really, really great. And honestly, I've kind of designed how I've wanted to practice like 3 or 4 times at this point. So I've gotten pretty good at like doing that self-reflection and like being able to make it what will work for me, because that's important.
Yeah. Well, it's really helpful just to hear your journey and how you were able to craft that to be what you needed it to be, because I think that's one of the big challenges these days in medicine is that lack of autonomy and that, to a certain extent, moral injury from, it's like, what needs to be done for your patient.
Yep.
The way things are structured doesn't necessarily allow that.
Yeah. I was glad when they kind of put a little more of an explanation on the term that everybody was talking about with physician burnout. I think moral injury is such a beautiful way to put that, because it really is. It just goes against everything that you believe your morals and why you went into medicine. I'm really glad that that got descriptive over time.
Mhm. Yeah.
So, yeah.
Why do you feel that personal and professional wellness is important?
I think that patient care really has two components to it. The first part of it is how you're taking care of patients, and then the second part of it is how you're taking care of yourself.
Mm,
Um, because to be honest, we all know this. Like, if you're not taking care of yourself, you certainly really aren't at full capacity to take care of other people. And I think med school and residency really push us to the limit of being able to do as little for ourselves as possible and have the maximum impact for other people.
mhm,
And that's just not a practical and real way to live. It's not sustainable by any means.
mhm,
So if you really go down that route, I think that you're not able to care for other people. A lot of people lose sleep. We had talked about this a little beforehand. Being
mhm,
sleep deprived being a huge problem, and it can affect your decision making. You can't always be there for your family. You could even get
mhm,
physically ill. So there's so many reasons to take care of ourselves. And I think that gets removed from that patient care equation, is that part of your responsibility is taking care of you to take care of other people. So I think
mhm.
it's hugely important, on both personal and the professional side.
Yeah. And for me, I've seen that when, yeah, it's like if I'm really behind with my notes, or
Oh God,
when
yeah.
I first started out, and yeah, just felt that I couldn't even get lunch sometimes,
Right.
and it affected my personal wellness. Definitely bled into like how am I showing up for those patients at the end of the day. I'm
Right.
definitely not in the same mental space as I was at the beginning.
Yeah. Yeah. Absolutely not. No, totally.
Yeah. So now for you in private practice, what about that has allowed you to practice the self-care that you need?
Well, um, I think there's been a few things that I have done that have really, really helped me. Some of it really, really goes around, well, really all of it is going around, how I'm delegating out my time during the day, what part of that time is
Mm,
for me, what part of that time is for work. And so, looking at efficiencies within my office, the nice part is I have complete control over that. So if I want to, change my hours, I can do that. I've changed a couple of times what kind of patients I'm seeing and what kinds of services I'm offering. And in some cases, I notice trends because I keep a lot of records for my practice for, kind of our
mhm,
key performance indicators. And I noticed trends where it was like, man, this one particular group of patients just stress me out. Like, I
mm,
don't have enough staff to handle it. The paperwork's insane. And, unfortunately, in business, it does kind of come down to the monetary part of it too. You've got to look at your
mhm,
time and your reimbursement. And sometimes it's like, nope, it is worth me getting some sleep at night and not laying awake about these patients,
mhm,
than it is to deal with what I'm getting paid. So, in some cases, those were decisions that I've made over the years. But I think it gives you such control over your hours too.
mm,
Um, I think if you can do the self reflection to really look at, when am I working the best during the day?
mm,
Are you a morning person or an evening person? And be open to changes to that discussion, because I always thought I was an evening person. And
mhm,
I mean, on a weekend morning, I'll sit with my coffee forever. I don't move very quick. But for whatever reason, clinically, by the time we
mm,
hit lunch, I am on time. My notes are done before I even hit lunch. Like, I am rocking and rolling. But you notice after about 2 or 3 o'clock every day, boy, I don't finish any of those charts. I
mhm,
end up getting behind. And so, you can think you're an evening person, and maybe after really looking at it, going, no, I think I'm stronger performing in the morning. May not like it. I need a lot of coffee, but I do a lot better for those first few hours of clinic. Looking at that, looking at the fact that maybe you can go do a half day of work and have the rest of the half day off, and maybe that works for you.
mhm,
Um, for me, I realized once I'm at work, I am solid mentally. I'm there. That's great. I cannot leave work at home or leave, sorry. Yeah, I cannot leave work at work when I go home if I work a half a day. Like
Mhm.
I will instantly start doing other stuff. Oh, I got to finish that. Oh, I should make sure I check on that report, and I can't
Mhm.
leave it alone. But I am capable of working really long days when I need to. So for me, I truncated my schedule basically down to 3 days a week.
Mm.
And I just work from like 9 a.m. till 7 p.m. And then those other 2 days of the week, I am so much more productive in my personal life because I can
Mm.
make more of a plan on how my whole day is going to go.
Mm.
So for me that works. So I think getting to change up your schedule, but doing that self-reflection, you gotta get to know yourself a little bit, know your limits.
And both
So
those
yeah.
limits.
All right, yeah, you got to know
Yeah.
those limits. That's important. So no, I've changed kind of what my practice specializes in my hours a couple of different times, and it's been a really good thing for me.
Mm.
So I think that's a nice thing about private practice.
Cool. Well, and sounds like, yeah, you get that flexibility and more of that control to
Mhm.
really craft, as you said, with that reflection, looking at what you need, how you're wired, your priorities.
Mhm.
And yeah, that may change in different seasons of life.
Yep.
But at the same time, how have you seen? I mean, isn't private practice stressful? I mean, you get all that control, but
Yep.
how did you learn the things that you needed to or get mentors? I mean, when you're striking out on your own.
Right. Um, yes. So like running a small business is stressful, I mean, and it's a different type of stress than medical school or residency. I think there's two things. One, making sure that you get yourself the right team of people.
Mm.
Um, the the practices that are the most stressful for physicians and that are kind of the most messy and disorganized realistically are run by docs who, were smart people, but they've got this opinion that like, I was smart enough to learn the human body. So I'm going to learn billing and I'm going to learn marketing and I'm going to
Mm.
learn all the things. Like you're going to do your taxes, you're going to do all the things. It's, it's a terrible idea. Like there are people who, just like you went to school for med school, went to school for billing. They went to school to be an accountant. They went to school to do office management. So like they have better training than we do in that. And I'm not saying you shouldn't be aware of the general idea of how those things work, but really let the people who went to school for this do it. you know
Mm.
and when you develop that relationship where you've had some conversations, you've really spent some time with them, and you develop that close relationship of trust that they can handle it, then
Mm.
it's just a matter of checking in, making sure that your practice has some systems in place for your employees so that they understand clearly what their duties are. They have ways of following through with it. You have easy ways of just checking in on it periodically.
Mhm.
And then you can do what you're there to do. You're there to see the patients. So, yes, there's going to be times where things are more stressful. I mean, we had a billing snafu in our software that all of a sudden I realized I wasn't getting paid by Medicare, and I looked and wait, nope, they haven't reimbursed me since May. Okay. So
Um,
yeah, no, and so that's a chunk of change that you're waiting on, but we've gotten it figured out. It's just these things take time to process. And,
mm.
because all of my other stuff is kind of running on autopilot with me just checking in, it's very
Mm.
easy for me to go deal with when things actually really do potentially go wrong and you have
Sure.
to go come up with a solution. Like I've got the bandwidth for it because everything else is, running smoothly without my immediate micromanagement. I'm
Mm.
all about getting away from that.
Yeah. Well, and I think that's something that's really hard for physicians because we've been trained to, it's like, you have to do well in school. You have to get the
Yep.
grades. You have to get the
Yep.
test scores, and you have to do like perfect care for your patient. And
Mhm.
yet it's like, okay, empowering and delegating. And
Right.
so not
Right.
only in the interprofessional, in the hospital standpoint, but it's like now it's like, all right, all of these other functions of a business
Mhm.
you have to entrust to others,
Yeah.
and because you can't do it all yourself.
No. no. And I think having that realization that you not only can't, but like really shouldn't try to do
Mhm.
it all yourself. You're right. It's totally ingrained into us from the very beginning. And especially residency, because you remember where like residency, you really had to do everything yourself because they needed to make sure that you could do all parts of it. And so you get really good at doing your procedure, like getting the patient numb, setting up, doing the procedure, cleaning up, like you do all of it, right? And
Mhm.
nope, that is why you have a back office person. and and honestly, it probably took me a good 2 years of really actively noticing that I wasn't using my employees for the things that I should be using them for. And I was setting up my own procedures, and I finally, something happened where I go, no, like count up the number of minutes I'm using and doing these
Mhm.
things. I could be seeing another 3 or 4 patients in a day based on how
Mhm.
much time it was taking. And like notes is the same way, right? Going from like
Mhm.
typing your notes, 8 to 10 minutes a note, to dictating.
Mhm.
Now we're down to 2 to 3. Like those minutes for that kind of stuff add up. So, if you start really looking at that, it's pretty easy to see that your time is worth significantly more than the, 18, 19, $20 an hour that you should be paying somebody else to go set that procedure up for you. So it's a numbers game, but I think the delegating's hard. It's very hard. It's not easy for many people, including
Yeah.
myself. Sometimes I still catch myself doing things and I'm like, wait, I could hand this off. I have somebody that can do this.
Yeah.
Yeah, it still gets me.
Well, and even as an employed physician, I find some of that with even my paperwork. And
Yeah.
some of it's just expectations of like, okay, if this is normal or this can be dealt with in the next 2 to 3 days, it doesn't have to be done right now.
Yeah.
I can sign the form, I can put it in my box, and it will
Yep.
get done
Yep.
eventually.
It will.
Whereas when I had recently graduated or in residency, it was like, no, you have to call up everybody yourself and get it all done right away. And it's
Mhm.
like, okay, maybe this is part of the teamwork or
Right.
just readjusting my own expectations.
Right. Right. Yeah. I don't think residency was what anybody expected. Anyway. So yeah, no, it makes a difference what your expectation of yourself is. um, I think we expect ourselves to be perfect and we expect ourselves to do everything, and then we don't realize that we really could be doing other things with our time.
Mm. If you were to go back to having recently graduated and
Mhm.
looking forward to where you are now, would you have expected to be where you are?
Oh God, no. God, no. Yeah, I came out of residency, I think, kind of the same way you did, where it was just like, okay, I have to do this as quickly as possiel. I need to see as many patients as I can, and everything needed to happen yesterday. And why wasn't I more prepared? And it just,
Mhm.
oh my God, like as if we would have possibly known how to do any of this stuff. We weren't taught business in residency, but
Mhm.
yet here I am beating myself up about not being crazy busy already, and worrying still about how you're going to treat patients. And I was always in the mindset that I was going to have to see as many people as possible. And oh my God, it wore me out so much,
Mm.
so much. It wore me out worrying about it to get to that point.
Mm.
And then it wore me out when I got there. So, you know, I I really wish I had known then how this was going to go for me, because I love where this is at now. I have the practice. I'm there 3 days a week. I decided I really wanted to have a small farm. And so I spend 2 days a week kind of working on my farm stuff. And I love being outside, and I get to really enjoy those days. And I didn't realize that I needed that much of a recharge, but that it was also okay to give myself that.
Mm.
And God, I think had I had those epiphanies soon, oh, I would have done this so much sooner. If I knew what I know now. Yeah. Yeah, I wouldn't have stressed nearly so much about it, but I get it. It's
Mm.
what gets kind of driven in.
Yeah. So now, with what you know and your experience and where you've been, how do you help doctors like others out there achieve their own personal wellness through private practice?
Yeah, I've been part of a couple of kind of coaching groups over the years. I've been coached. It really took until the last 3 years before I started embarking on that, and it has just made all the difference in giving me that mindset and that courage to really like go forward with those decisions and
Mm,
to be able to just pivot so easily when things are going wrong or not quite the way I expected, and let's turn it into something good.
mhm,
Um, a good example is that whole Medicare issue with not being paid. I turned around and looked at it and went, I have been wanting to drop it's unfortunately my lowest reimbursing by about a third.
mm,
I have wanted to drop that and go more to a concierge style practice, and I've been too afraid to do it. And
mhm,
they haven't paid me in a fiscal quarter and nobody died. and
mhm,
I mean, my practice didn't sink and I didn't die. And it wasn't as scary as I thought it was going to be. So coaching has allowed me to take what would have been, years ago, just a complete freak out meltdown about not having been paid by an insurance in a full fiscal quarter.
mhm,
But I immediately was able to turn that into, maybe this is actually giving me like a bank snapshot of how my practice would look
mm,
if I decided to stop taking that insurance. Like, I've wanted to do it. This is the universe essentially giving me the information of, okay, here's
mhm,
how it's going to look financially. This was your biggest concern. Now go do it. And I'm so glad I'm now able to get into that mindset. And it's helped me so much. I meditate regularly now. There's
mm,
so many things that have been enriching in my life personally and professionally from it. So I decided last year to go ahead and start coaching other physicians. And at
mm,
first I was kind of working with docs, mostly who are trying to kind of revamp and redesign their own practice. And I still do that kind of consulting and coaching. But then I
mhm,
started getting a lot of questions from people that were just coming out of residency.
mm,
And I was like, oh, wait, so you're going to actually go the route I did and you're going to not, go for the big hospital job. You're going to instead go for private practice right out the gate. This is great. Let me help you do that.
mm,
And at this point, I've set up 2 to 3 businesses, and it's really not as hard as it seems. There's some upfront work, and there's the getting your team together, and there's the really doing that inner work, I think, of just type of practice you want to have. Because if I had had a coach at that time in my life when I was coming out of residency and getting into this,
mhm.
I mean, I think it would have saved probably a year and a half of the hard lessons, honestly. Like,
Wow.
this would have been stuff that I wouldn't have been so stubborn about doing everything myself,
Mhm,
and I wouldn't have been so worried and laying awake about the finances and all of that kind of stuff. There's a lot that I would have done differently and sooner had I
mm,
had that kind of advice. So um so I am more than happy also working with residents that are coming out and they're really thinking they want to do this, with getting them set up and going. I mean, we can get this from zero to fully open doors in like 8 or 9 months at this point. So it's doable.
it's really amazing. And I think it's really helpful. I mean, I've been coached and been part of coach training even now, and just how it's the stories that we tell ourselves and what we make things mean. And so, yeah,
Yeah.
the Medicare not reimbursing, that's just a thing. And then it's
Yeah.
how do you choose to interpret that?
Right. Right. Yeah. How do you choose to read this?
Because, yeah, there's ways that we've all gone down those paths and
Yeah.
had those freak out moments, but you can choose to do it
Hmm.
a different way. And so it's like, what's most useful or helpful to you?
Yeah. Yeah, absolutely. I think the meditation for me was huge. Just getting to unwind through that time, that worked really well for me. And I think some people they've got exercise, some people have got other stuff, and
Mhm,
it's just meditation worked for me. But yeah, I think it's important to learn what's going to work for you and how you recharge yourself.
Mhm. So, in addition to recharging and finding what works for you, what would you tell someone coming out of training as far as a piece of advice?
Mm, Probably that the sooner you can start thinking about how you want your life to look and how you want your medical career to be, the quicker you'll find that happy place.
Mm,
I think that self-reflection is so important,
yeah,
so huge. So,
it's it's really helpful because it's so easy to just go, 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 and that's been what our training's all about. And
mhm.
then you could do that for a whole career, and then look up and realize that wasn't how I wanted my life to look.
Right, right, exactly, yeah, and you don't wanna have that, the mid-career crisis of, "Oh my god, what if I completely went into the wrong thing? What if I shouldn't have been in medicine? What about this?" But, I think that that's a good indicator too that the burnout level has just increased so much because that mid-career freak out used to happen, when people were having a 30 and 40-year career. So by like year 15 and 20, they're going, yeah, maybe I should go do something else. Right now, people are having that mid-career freak out at like year two. So
Hmm.
like the tolerance, tolerance is there. The residency is still just as hard, but I think the demands and the changes in the healthcare environment are completely changing that. And if you can really figure out what you need and what you want, that risk of burnout and having that happen to you so quickly, I think really, really just diminishes.
Well, thank you so much for joining me on the podcast
Yeah.
today.
Yeah.
If
Thank
someone
you.
if someone wants to learn more about you and what you do, how they might work with you, how can they
Yeah.
find out more?
So the coaching practice is named Visionary Practice Solutions. And it's pretty well just a direct thing to me at this point. But if you go to visionarypracticesolutions.com, you can find all the contact information and a little bit of info about the podcast that I've gotten started doing.
Awesome.
Yeah.
Well, thank you so much, Dr. Neitzel, for joining me on the MedEdWell podcast and sharing such amazing insights.
Oh, thank you so much for having me. This was awesome.
Mm, thanks. For all of you listening, I want you to consider how you can apply what you've learned from Dr. Neitzel in today's discussion. And then please share this podcast with another doctor in your life and subscribe to the podcast. You can help change the culture of medicine and promote wellness for your patients, your colleagues, and yourself. Thank you so much for all that you do, and have a great day.